in my opinion, the most important part of finishing a case is the hard tissue contouring after treatment. And in my practice, I start with this burr, which is a round diamond, red stripe, fine diamond. Well, we call it a wheel diamond. And I'll do all of the major gross adjustment to the incisors and to the lowers with this in the beginning. So we'll just run this. We don't run, but mostly just at almost a stall out speed. And the first thing I'm doing is just catching incisal edges and getting them close, because after I'm done with this, I'm going to come back in and work on refining those edges with a sandpaper disc. So I will shape the teeth and do the majority of cuspid shaping, working on the laterals, taking any rough edges off. After I've done a little bit on the upper, I'll move to the lower. I start behind the tooth and just take out any rough edges and adjust the lingual buccal of each tooth and make sure it's very smooth. Take out any of the rough edges. Once I've done this, I'll go back in and do the incisal edge to make sure that we're nicely contoured. At this point, I'll stop. I'll change to a flame diamond. It's a small chamfer burr. Again, a red striped fine diamond. And I go now to the facial surfaces. I'm taking out any of the stains that might be in the tooth from treatment. We are just doing a very light adjustment on the enamel. Sometimes I'll just wipe away the dust, the tooth dust, to see what this looks like. I'm adjusting the facial surface. Many doctors are a little afraid to get on the facial surface, but if you just use very light strokes and a fine diamond, you won't get into the dentin. You'll just adjust the enamel slightly. I want to make sure I have a nice contour from the central to the lateral, and the lateral to the cuspid, and then from the cuspid to the first bicuspid. I'll even do a little bit more shaping of the incisal edges on the cuspids, and I'll do both sides. I can wipe this away with my glove and get an idea of how this is starting to shape up. Looks very nice. I'm not afraid to get on the marginal ridges to make sure that our marginal ridge heights are the same. Then I'll come to the other side. You doing okay, Jeff? Mm-hmm. Okay. Again, we're just making very light strokes. We're adjusting to make sure that the smile flows from the central to the lateral, and then from the lateral to the cuspid, and from the cuspid to the first bicuspid. One thing that happens many times with adult treatment is the teeth are slightly warmed, so they have this 90 degrees joint here from the facial surface to the incisal surface. So I like to come and round this. I'll take my burr, I'll do the facial surfaces as well, and then I just like to round that edge so it's not so sharp. Again, we're catching any of the stains with this fine diamond, shaping the edge just slightly, making sure we have a nice transition from one tooth to another. Okay, it's at this point where I'll stop. I'll use a black polishing point from Reliance. Get a really nice shine to the enamel. Take out any of the surface scratches that might be in there. I do catch the incisal edges. We run this almost at a stall out speed. You can't run this on high, or this rubber point will fly off the shank, and it's not pleasant. So we'll just polish everything real nice, get a nice shine. If you can see that this lateral is a little bit square shaped here and a little bit almost the same length as the central. So I'm going to come back in with my sandpaper disc and work on the incisal edges, my final detailing. Again, we're at stall out speed here. If you get this going too fast, it'll heat the tooth up. The patient will feel that. And the sandpaper discs. Oh, I'll use a little cotton roll with some water on it, and we'll just take away any of the polishing dust. Now what I'm doing here is I'm coming from the lingual. I want both edges to be about the same. This makes it very easy to go from one side to another to make sure that our incisors are the same length and the same shape. We can come in and work on the lateral a little bit. We're going to shorten this lateral slightly, but try to keep the same contour from the central to the lateral. Now I'll get those two fronts about where I want it. Now this lateral needs to be shortened slightly, and we need to open up this embrasure. I'll usually have my assistants have a couple of these ready to go, so we'll just switch this out. Now once I have most of my contours and the shapes of the teeth, then I can come in and open up the embrasures. I'll start with this. This is the sandpaper disc, and we'll use this to get our marginal ridges just right, and then we want to just open up our embrasure. This sandpaper disc is a little bit thick, so what we'll do is we'll transfer. This is a diamond disc that fits on the mandrel of the slow speed. And this is really nice because it's the fine tuning, and it can really come in and open up this embrasure. Many times when we've finished adults and we've done a nice job of smoothing and contouring, this embrasure is gone, and that's what makes the case look like the teeth are still old. We want to bring back the youth to the enamel and to this tooth, and the best way to do that is just opening up this embrasure between the two front teeth. Once this embrasure is open, all of a sudden his smile becomes youthful again. The tooth doesn't look like it's older and squared off and worn. So we're just coming in and opening up the embrasure between these two teeth. Now we're going to do the same over here. This has a little bit of a worn spot on this one incisor, so we're going to be very careful not to touch that. Just work on the upper two here. You can see by doing this, we've just made this tooth so it's not so square now, and it's got its youth back by opening up the embrasures. How you doing, Jeff? You okay?
Yeah, I'm good.
Good. We're almost done here.
Just,
Yep. Okay. Now I notice that this tooth is a little bit more pointed than this one, so I'm just going to flatten this just a little bit with a football diamond, and then I'm going to make sure that we're smooth on the lowers, and we'll be all done. Okay. And the wheel diamond. And then, good, Jeff. Okay, and bite down. This is polish with the black polishing point. There we go. Thank you. Okay. Jeff, that's it.
all right.
Big smile, Jeff.
Congratulations.
Good. Cool, cool.
So what I will say at this point is that I tell the patients that I'll have them look. If they feel like one tooth's a little longer than the other one, when they go home and they come back for retainer check, I can always shorten one tooth to match the other.
Okay.
Looks great. Congratulations.
Thank you.